Hello, welcome to the Covid-19 Pandemic Quality and Safety Tools Talks. This is the first in a series, and I'm Peter Lachman, lead faculty for the Quality Department at the Royal College of Physicians and Chief Executive of the International Society for Quality in Healthcare. We are bringing you a series of talks on how to maintain quality and safety during the pandemic crisis. There are going to be a number of talks, and this first one is an introductory talk on the quality and safety at this time. It's going to be a little theoretical, but show you how you can start using the quality and safety tools that we have taught in the past in the present time and in the challenges that we face. The program is going to have about 6 lectures, but maybe more if there is demand for it. And the first one is really looking at the overview, and then we're going to go deep down into the different systems that you might want to study and how you test changes. I'll be joined by John Brennan and John Fitzsimons, both faculty in the department, who will be helping me present these presentations. There are 6 domains of quality, and I'm going to start with the first one, which is safety, because this is high in the mind of most people, particularly with a very highly infectious disease such as coronavirus. We are keen to make sure that safety includes both caregivers as well as patients, and that is the protection of staff and patients at all times. This will require protective equipment, but we also need to look at the other areas of patient safety, such as medication safety, infection control, falls, delirium, pressure ulcers, which are still there and do not go away just because we have a pandemic. So safety is on our mind the whole time. The second area that we need to really concentrate on is people-centered care. This includes both providers of care and the patients who receive care. And this means that we must treat each other with dignity and compassion, as well as treat our patients with dignity and compassion. And remember that in this difficult time, there are many difficult things that we need to decide, many new safeguards we need to put into place, but we need to always remember dignity and compassion, respect and kindness are the foundation of all that we do. This will require us to make some ethical decisions and to consider what really matters to us and what really matters to people. So what matters to me is very important in this time, as well as using all the tools we have to remain kind and respectful, both to ourselves as well as to the patients. Timeliness of care is the third of the quality domains. And this is very important now, and particularly becoming more prominent with the timing of testing, when to do the testing, and also how to spread it out. But of course, there are other things that we're going to have to consider. How the rest of our healthcare service has been affected, waiting times for people with chronic conditions, how are we impacting on surgery that has now been cancelled. So this timeliness goes beyond the pandemic itself. This leads to the fourth area, which is efficiency. How do we use our scarce resources in developing new processes and making sure that we do not have waste? Healthcare is particularly wasteful, and we need to make sure that we use all the resources we have in the best way we can, particularly now that we have this pandemic. Effective care is ensuring that we give the right care all the time. Now, this is going to be quite difficult because the evidence is changing. There are a lot of theories going out of what works and what doesn't work, and we're not really sure. So effective care requires us to be inventive, to test what works, and to spread what works very, very clearly to other people. So effective care means we should have standardized operating procedures, know how to do things to make sure people are safe, and to ensure we provide the best care possible at all time. The final and possibly often the most important one is equity. Ensuring that all people are treated the same way no matter what their background, and also that all staff have the same chance of having equal protection against infection. So these are the 6 domains of quality applied to the pandemic. Now let's see how we can make them real. Well, basic quality management was first started by Duran, who came up with the Duran trilogy, which has 3 elements. One has to plan quality, so while we're planning for the pandemic and how we're going to respond to it, quality should be part of that planning. We have to set up controls and measurements which will enable us to see how we are doing, how is our process working, and how are the outcomes, how many people survive and how many people do not. And finally, as we are doing the planning and the control, we'll see areas for improvement, and this is where we are really going to focus on. We want to know what really works well so we can spread, and what is not working that well so we can improve. So to understand improvements, we look at Edwards Deming, who really came up with the 4 elements of improvement theory. And these are what we're really going to concentrate on. So I'm just going to give you the high level area here. To improve, we have to understand our system, how it operates, what is working well and what is not working. We then have to look at the processes within the system to see if they're delivering the outcomes that we want them to deliver. And we also want to know the variation in the process. Why does it work well on one day and not on another? That leads us to understanding who made the processes, the belief and attitudes of the people who run the process, and really work out what they want to do to get the outcomes. And finally, this leads us to how do we make changes to improve. Now, over the last few weeks, as the pandemic came on, there have been many changes in the healthcare service, but we have not really tested them often. So this gives you a good construct to go forward. So to do that, we need to understand the complexity of the system and really what happens. And this starts with the big one that I'm going to concentrate on, the individual processes, the human factors, the different elements of the process and of the system that we need to study. Of course, there are many other things like system issues. Healthcare is a complex adaptive system with many different parts that weren't working well together and maybe in silos, and we need to look at it. And now we're faced with a new clinical complexity. We have to understand the culture of the system and of the individual. What do people believe in? And what is the culture within the organizations? And finally, we need to look at the resources and supply chains, which are now very difficult because of the demand, and also how we deal with access, security, and personnel. Now, these complexities make it very difficult for us to think that it can be made simple. However, we believe that using quality methods and understanding small tests of change and ways to do things through the prisms of system analysis, we can make a difference. So to do that, I'm going to apply some human factors theory, which comes from Pascal Carrion and her team. And this is called the SEEPS model, or systems engineering model, which really looks at the human factors. So based on Donna Bedian's 3 methods or theories of systems plus processes lead to outcomes, we start at understanding what our work system is. So for example, if we want to do testing, what do we need to do testing? And that is the major focus of prevention, is finding out what is the number of the population are infected. So therefore you have to have organization, you have to have an environment for testing, you have to have the right people to do the tests, you have to have the right people to receive the tests and decide who's eligible, we have to have the tasks that have to be done to set it up, and finally you have to have the tools and technology to do the test. Now, you can apply this to absolutely any of your processes and your work systems where you're working, whether it be in an emergency room, in intensive care, or a GP practice. You can apply this idea of who are the people we need and who are the people we treat, what are the tasks we have to do, what tools and technology do we need, how do we organize ourselves, and what's our culture, and what's the environment. Now, to get work done, you need to have processes which are either physical or cognitive, and this is the professional work and the work we do with patients. And there is collaborative work between people and professionals. And finally, this leads to outcomes which could be desirable or undesirable. If they're undesirable, we need to adapt, go back to the work system, work out what we need, and then do the processes. This is the foundation of how we're going to carry on in this series of talks, is refer to understanding the work system and how we can improve the work system through improving our processes to get the outcomes we want. This means that we have to understand what we really do want. And really, it is, for me, quite simple. What we'd like is to have reliable care. Reliable care is the patient or the person gets the care they need the first time and every time. Now we know healthcare is fairly unreliable and that people don't get the same care everywhere they go, and they don't get it the first time. So to do this, we look at the work of Week and Sutcliffe, who came up by studying high reliability organizations. And this means that we must be preoccupied with failure. What is that? It's not preoccupied with failure, but it's constantly studying our work system to see what is working and what is not. And if we can work out what is working, then we can really spread it to other areas. When we study what is working, we mustn't simplify it, because we have a complex adaptive system. Many people with different beliefs, many new challenges now, so we need to understand that we might have a complex solution to the complex problem. The commitment to resilience is constantly learning, looking at what we do and understanding why we do it. This is very important, and that means that we need to constantly look after our psychological well-being to make sure that we can bounce back as soon as possible. We need to be sensitive to the front line, understand what they're going through, what their needs are, and use all the tools we have to make sure that we listen to them and understand that they can often find out the solutions. This means deferring to their expertise. They know what to do and what is best. Now, these 5 elements are very important. There are organizations that have used these as the foundation of their approach to the pandemic, and they are constantly studying their work system, looking what works all the time so they can spread it and strengthen, and looking what does not work. So the key issues that we really need to do is about people. And for people, we need to really build teams. The answer to the pandemic is teamwork across the whole system. And this has seen remarkable changes over the last few weeks. We have seen hierarchy being flattened as teams now grow and understand they have to deal with a problem they hadn't really thought of dealing before. The new lines of communication, channels have been opened that were blocked before. Silos are being broken down. We've had adapted our traditions. Tradition is good, but we've had to learn what really is important and what is not. We have to change across our professional boundaries, and that doctors, nurses, allied professionals, they're all important. Everyone who's working together in a team is important, and the boundaries might change. And finally, in the team, we have to provide this important element of psychological safety, which is more complex than physical safety, because even though you might have your protective equipment, you still have to make sure people feel able to challenge, to call out safety issues, and to be able to be respected for the work they do at all times. So the key issues that this process is setting basic priorities, looking at patient and safety of staff, the safety of patients and staff, the situation awareness of what goes on, the funding, how we're going to really get this done, what the accountability lines, deciding who will deliver the service, and making sure it's sustainable. Now, when we look at the safety of patients and staff, this is crucial for all of it, but that requires us to have situation awareness. In one of the talks, we'll be talking about the importance of making sure we understand how this can enhance our performance and enhance the outcomes we get. So in summary, over the series of these talks, we'll be studying and analyzing processes, we'll be seeing what needs to be changed, we'll be teaching you how to do the changes through multiple tests of change and how to measure success and how to measure things that need to be improved. And we're going to ask you to think laterally and can keep it simple. So that's the summary of the start. And next week, John Brennan will be talking on understanding the system you want to change and processes and how to study them. Thank you. I'm Peter Lachman. If you want to contact me, my Twitter account is below, as well as are my email addresses. Thank you very much, and I hope you enjoyed the talk.